Welcome to our brief on systematic or general circulation. So what happens here? This is the movement of oxygenated blood from the heart to the entire cells of the body. So let me take you through the routes. So we all know how blood gets back from the lungs. Just check my other video on pulmonary circulation. So as soon as blood gets into your left atrium, right, it's contracted and pumped straight into your ventricle, right, your left ventricle. So from the left ventricle, it is now pumped to the aorta. Now the aorta has three branches. What do we have? The first branch is called the ascending branch, and that ascending branch branches off to give you coronary arteries, and those coronary arteries, you have right and left coronary arteries. Those are the ones that supply your heart, right? So we now have, after the ascending branch of the aorta, we have the arc of aorta, the arch of aorta, and then the arch of aorta basically has three branches, right? Now to the branch that supplies your, let's see, the right side of your body, right, the right side of your body rather, which is called the brachiocephalic trunk or the brachiocephalic artery, right? So which basically splits into two. You have your right common carotid artery, which goes to the brain, neck, brain, and then we have your right subclavian artery, which is subclavian because it's beneath your clavicle, right? That supplies, which basically the first branch it gives us is the vertebral artery, right? Goes to the brain, and then the other branch, which is your subclavian, once it gets to the axilla, becomes your axillary artery, right? And then it becomes a brachial artery around your arm, right? So when it gets to the forearm, you have ulnar and radius, so the ulnar and radial arteries, and then your palmar arteries, which supply the palm as a whole, right? So when you come to your left side, back to the arch of aorta, the other branch basically that is from your left side, right? The other branch is your left subclavian artery, right? And then the other is the left common carotid artery. So there's no brachiocephalic trunk or artery for the left side. So the same thing that the subclavian artery did, giving off your vertebral artery, giving off your axillary artery, it does the same way. So now let's come back to the arch of aorta. Then of course the last part of the arch of aorta, which is your descending aorta. Within the thorax, your heart is within your thoracic cavity, right? So within the thorax, basically there's a thoracic aorta that supplies the muscles within your thorax. So once it gets to the abdomen, which is the split between the thorax and the abdomen, is where the diaphragm, right? Once it gets to the abdomen, it becomes abdominal aorta, and the abdominal aorta branches a lot of things like your celiac, trunk, mesenteric, superior mesenteric, inferior mesenteric. All of those that supply the GIT. You get that, right? So the abdominal aorta, from there, once it gets to your pelvic cavity, it's called your right and left iliac, right? These are the iliac arteries. So the iliac arteries, you know that the split happens around L4, right? Splits into right and left iliac. So the moment the iliac arteries gets to your thigh, it becomes a femoral artery. It's so sweet, right? So the moment it gets to, let's say your patella, right, it becomes popliteal artery. So popliteal artery then moves downwards, right? We have tibia and fibula, right? But the artery called there is tibial artery of anterior and posterior. So basically that was a brief calculation rather. Thank you so much.